Today we're going to talk about how to meet your patients and how to set expectations. In nursing, which is what we do, we have a unique opportunity to meet tons of people, but we meet them at their worst. We see them at their weakest, when they need something that they can't provide for themselves, so they come to us for help. When they come, they're scared. When we meet them for the first time, we need to understand and we need to remind ourselves that while that is our world of work that we are grossly familiar with, it's not theirs. They may have not been in an ER or hospital or clinic in years. They may not know how things are done after the pandemic. The whole world has changed after all. Why are they here? That should be your first question. And then how they're doing. Now you may go in and ask them why they're here after they've been there for hours and hours in the ER and 14 other people before you asked them the same thing. They're going to get a little upset. Or you may be going into a room on a floor or in a unit and they may have been there for days. While you had your long weekend, they may have come close to seeing Jesus and been brought back, and they look at you like you've grown a third head. So when I say why are they there, I'm saying no before you get to the bedside. Have a conversation with them or the family member, if they can talk to you, about why they're there and what is being done for them now. Be realistic and be human about it. Know when it started, what their journey through it has been. If they've spent 3 days on a ventilator in ICU and you're the first person they talk to, know that. If they've spent 8 hours in the lobby and finally gotten to an ER bed, please know that. They've had a long wait. They came in an emergency in their mind, and when they came to us for help, we took their vital signs, triaged them, and said, oh, you're going to wait in the lobby for a little while. What you really have is an urgent problem or not even an emergency at all, and you're going to have to wait. So they're not going to be very happy when they get to you at first. It is your job as the nurse to soothe those ruffled feathers, to put your big girl panties on or big boy panties on and take a chewing, because sometimes they just need to vent. And wouldn't you rather them vent to you than on a phone call to somebody complaining up in the offices and the people that run the hospital? Wouldn't you rather have that conversation face to face? But understand, when you have that conversation, you have to be professional about it, and you have to put a smile on your face. But it's okay to remind them they're not the only patient in the emergency room, and isn't it fortunate that they weren't sick enough to come back immediately, because that means they were dying. I mean, I might soften it a little bit, but it is the truth. So we can all be grateful that they weren't as sick as they thought they were, but we're here to help them with their needs now. It's up to you to lay the groundwork to make that an easy road for you and the patient to walk down. The next step is to know what caused their problem. What were they doing when it happened? That way, no matter where they are in their stay, you can start talking to them and setting the groundwork about how they prevent their problem in the future. Because after all, self-care is the goal. You want them to get well and go home and prevent these kind of problems in the future. So every opportunity to talk to a patient about what brought them into the emergency room, how they landed there, what they can do different to prevent trips in the future, we should all take and capitalize on those moments. How can you meet their expectations or not? I can't tell you, and I'm not really sure why, but everybody comes to the emergency room hungry. I can't tell you how many people come with a belly ache or throwing up, and the first thing out of their mouth is, can I have something to eat? No, you cannot. It makes people mad, but as soon as you go on to explain, your stomach is upset. It's already irritated and rejecting everything that goes in it. Not to mention, when you vomit and you're ill, you run the risk of aspirating, and some of that vomit can go into your lungs and it can cause you to die. That usually settles them down, makes them understand that your intentions are not for them to suffer with hunger. It is to keep them safe and get them well. And that is one of the best ways to set expectations for families and patients, is to let them know that your priority is the patient and the patient's care. And that doing that in the safest, most efficient manner is what our goal is, because we want them to leave and be able to care for themselves. When you set that expectation, especially for the family, it is okay to remind them that your urgency or your priorities are based on a clinical judgment, not an emotional one. And while you know that their passion and their emotions related to their loved one's illness is important to them, there are rules and there are processes in a hospital that have to be followed. And that is for the safety of their family member as well as others. At the end of the day, we're all here to serve around common sense. And common sense tells us a lot if we use it. That everybody's a human and everybody has reasons for the way they act or the things they say. And as long as you can get on the same page together, you're doing no harm and taking no shit. Have a great day.